Good morning, good afternoon, good evening, everyone. Welcome to this webinar, The Power of Policy Analysis, which is launching a special issue of the International Journal of Health Policy and Management. This journal supplement builds on the work of the Health Policy Analysis Mentorship Program, which is supported by the Alliance for Health Policy and Systems Research and coordinated by the University of Cape Town. I'm Zubin Shroff, a Technical Officer at the Alliance for Health Policy and Systems Research at the World Health Organization. And before we go ahead, just some housekeeping and questions. If you have a question for any of the panelists, please use the Q&A button and not the chat box. And the second is this session will be recorded and made available after the webinar finishes. Could I have the next slide, please? So just a brief background about the Health Policy Analysis Mentorship Program. And the Health Policy Analysis Mentorship Program was launched to address a critical lack of capacity for health policy analysis in low and middle income countries, particularly health policy analysis carried out by low and middle income country-based scholars in these settings. And it was particularly surprising to us who work in this area what the critical capacity challenges were, given the applicability of health policy analysis to address some of the most pressing challenges in health systems, strengthening efforts in health system research. And to this end, we developed this program, and it's a mentorship program in terms of which providing tech mentorship in terms of supervision and support to LMIC-based doctoral students to bring in health policy analysis perspectives within their doctoral thesis, as well as to provide some funding in the form of a bursary to enable them to carry out this work. We've had two cohorts of this program. The first cohort consisted of 9 students, the majority of whom were women from countries in Africa and Asia. And based on the success of the first cohort, we now have a second cohort of 11 students who are also being supported now through this program. And the supplement issue that we are launching today brings together the work carried out by the mentees supported in the first program of work. So that's a bit of a brief overview about the Health Policy Analysis Mentorship Program. And going on to the schedule today, we have 2 presentations coming up, followed in which we have a panel discussion and then open it up to question and answers. So I'd like to hand over to Lucy Jolson from the University of Cape Town. Lucy is health policy and systems researcher interested in HPA and has supported and mentored HPA scholars from around the world. Jeff, could I have the next slide, please? And she's based at the University of Cape Town as a professor at UCT, as well as at the London School of Hygiene and Tropical Medicine. Lucy, over to you.
Great, thanks very much, Zubin, and very good to be here. Can I check that you can hear me?
Loud and clear.
Thank you so much, Jeff. So it's a real pleasure to be able to launch this special issue of the International Journal for Health Policy and Management. Next slide, please, Jeff. This special issue brings together 7 papers, all of which have been led in terms of authorship by emerging LMIC scholars. It brings together new authors from Ghana, South Africa, Uganda, India, and the Philippines. Within this set of papers, 4 report empirical studies, 3 present innovative qualitative synthesis work, and 1 offers an important methodological reflection. I'll talk more about the whole set of papers a little later, but there are 2 colleagues who are going to give us an initial insight into their particular papers. And I'm going to invite them shortly to provide us with brief introduction to their papers. Before I do that, I want to say again, thank you to the journal itself. Thank you to all of the fellows involved in the first cohort. And thank you both to Zubin and to my colleague Meilin Shunking for their support for this edition. Now, the 2 colleagues who are going to present their papers are first Sudha Ramani, whose paper you can see the title of on the slide, and then secondly, Moses Mukuru. Now, these two authors have, I'm afraid, only been given a very short period of time to give you a taster of their papers, but that's to whet your appetite to read more. So at this point, I'm now going to hand over to Sudha and ask her to introduce her paper. Thank you, Sudha.
A very good morning to everyone, and my name is Sudha, and it's a pleasure to participate in this launch of the special issue today. So thank you, Lucy, for introducing us and giving us this opportunity. So my interest has always been in why in India we have been able to make these great policies on paper, but when it comes to implementation, we seem to stagger. So we are not able to deliver many of these well. So this particular paper is an example of this policy implementation gap that we often see in across LMICs. So our paper is titled, as Lucy introduced, Sometimes Resigned, Sometimes Conflicted, and Mostly Risk Averse, Primary Healthcare Doctors in India as Street-Level Bureaucrats. Lucy, Shivakami, and Nilesh are co-authors on this paper. As this title suggests, this paper focuses on the actions, the behaviors, and the choices of doctors at primary healthcare facilities. For this paper, we collected data from one rural district in a western state in India. What happens in these settings is that doctors often get blamed for not delivering good care, or they're told that they're not being responsive to the needs of the patient. At the same time, the doctors say the patients don't come on time, or they do not trust their judgment. But in this blame game that happens, what really happens is that the care that gets delivered suffers, and the good primary healthcare policies that we make, they get diluted and not implemented as well as they should have been. So with the help of my with the help of my mentors in this paper, we have tried to move beyond this blame that is happening and look at doctors' actions through this lens of street-level bureaucracy. So Lipsky's street-level bureaucracy, the theory states, it states that people in the front line, they're not just implementers. So they're not people who blindly follow all the policy instructions which are given to them, but these are people who can think on their own. They make decisions in their context, they cope with several challenges, and they, in the end, they act in ways that make meaning to them in their own context. So for example, if you see in my study, there are many examples of how doctors cope with the several organizational challenges, institutional challenges that they face. Okay, sometimes they do only one outpatient clinic instead of the two that are mandated. Some of them are extremely risk averse, so they refer a lot of patients who could have been treated at the centers to the at the primary level to the higher level centers. At the same time, you also see some doctors who are extremely dedicated and they go out of their way to actually perform duties that need to be done. Okay. Over time, what we found was in these primary health centers, both the good practices and the bad practices, all these tend to get institutionalized and embedded as ways of doing things. So these are ways that get routinized and adapted. So no one today really questions at these health centers whether these are right ways to do things or wrong ways to do things. And I think one important learning for us has been that it's very hard to change these by making reforms from top down. So anything that we do has to be done bottom up. So in fact, if we look at this entire issue, there are so many wonderful contributions from my colleagues. It's all about power and politics at every level of the system. And this particular paper that we have been involved in, this shows that politics is not something that happens only in the high levels, but also in the front line. These people are all frontline actors who are a part of the policy process. So I will end here. This is my last point. So thanks to Lucy, Zubin, the journal, and everybody for organizing this launch. And thank you everyone for listening.
Thanks so much, Sudha, and a lot packed into your 4 minutes. Really appreciate it. And I'm now going to hand over to Moses to introduce his paper. Moses, over to you.
Thank you very much, Lucy, and all the participants into this for this webinar. Our work on elite influence on policy processes arises from the discussions about the persistence of high maternal mortality in Uganda during the FDG period, even after undertaking several reforms in the policies. And this persistence of high maternal mortality and the failure to achieve targets has mainly been in several research explained from epidemiological, intervention, and health systems perspective. But with limited attention being paid to the role of policy elites and their interests, provide a better understanding of why certain policies work or fail, because policies in our conceptualization emanate from decisions of the elites and the process that involves the power and interests. So the process that leads to those policies is underpinned by power and interests of those that are those who are involved in the policy processes. So in our paper, the actor is policy. We applied the elite theory to examine how national policy elites' interests and power dynamics influenced Uganda's maternal health policies in the MDG period, provide new insights on policy failure. And we found that the policies in Uganda for maternal health in the period of the 2000 to 2015 were mainly shaped by powerful domestic elites, mainly towards their personal interests, largely political and economic interests, political, especially vote winning, and economic in different ways, with the maternal mortality reduction pushed to the periphery. And this can be attributed to the guidance of policymaking in Uganda, which makes, first of all, policymaking a central government activity, but two, also a process that is dominated and controlled by powerful elites. And the same process relegates the less powerful to advisory positions in the policy process, who merely have to be consulted, and their ideas are advisory, but have no influence on the ultimate decisions that constitute the policies. And so because of this, maternal health policies ended up skewed towards powerful elites and written interests, personal interests, rather than the stated public goal of reducing maternal mortality. And here we see that actually, contrary to the instrumentalist view that public officials will act in the interest of the public, we realize that sometimes they can act actually in personal interests. And so we conclude in that paper by recommending reforms in the policy processes to prevent public officials from infusing policies with their personal interests, but also opening up the policy process to allow for the percolation of ideas from the front line and those that seem to be having less power, but also from the public, so that at the end of the day, the policies reflect the public interests and goals. So that's overall the paper. The actor is the policy, which we wrote, and we largely discuss interests and power underpinning policies and how that determines success or failure of the policies. I would like to acknowledge the fellowship, the Health Policy Analysis Fellowship, for the support in terms of mentorship and grounding in health policy analysis theories, literature, and methods. And also the grant, I received support from the fellowship also to conduct the study that informed this work, but also I received some partial funding from a project from the Makerere University School of Public Health. And also thank you very much, because I also received personal mentorship from you, Lucy, and Maylene in this process. Thank you very much.
Thank you, Moses, for this presentation. And now we go into the panel discussion. And before we go into the panel discussion, I'd like to introduce the panelists. Lucy, we've been introduced to and been leading this discussion. The other panelists, first up, Irene Igipong is a public health physician whose work focuses in the area of health policy and systems research, health policy and systems capacity strengthening. And she's affiliated with the Ghana College of Physicians and Surgeons. We have Muringa Mukanu, who is a health policy analysis fellow in the second cohort in the public health researcher from Ghana, currently doing her doctorate at the University of the Western Cape. Her research focuses on policy reforms around healthy diets and food environments in Zambia. We have M. Sivatami from the Tata Institute of Social Sciences at the School of Health System Studies, focuses on gender and health systems. And we have Eleanor Weil, who is a PhD candidate from the University of Cape Town. Eleanor was a mentee in the first cohort and is now helping coordinate the second cohort. And her PhD work focuses on the relationship between social values and health systems change, looking at the national health insurance policy in South Africa. So thank you all panelists for being here and part of this panel. So let's begin. So with the first question to Lucy. So Lucy, how do you think this edition and the overall program of work adds to the HPA knowledge base?
Thanks so much, Zubin. So in this edition, there are 7 original papers addressing really important topics. Now, in practice, the health policy analysis knowledge base for LMICs is often focused on agenda setting questions. But in this edition, all the questions and issues are around national level policy development and implementation. The papers together offer insights into the political and organizational factors that influence policy change within national settings. They particularly offer insights around actors and power dynamics among actors and around the institutional factors that influence those dynamics. There's a particularly interesting theme across the papers that speaks to the enduring dynamics between top-down and bottom-up power flows, which remains a critical challenge for health systems and one that is relevant to our work currently to address COVID-19. Health policy analysis work of this kind gives us the sorts of insights into health systems that we need in order to strengthen them. The range of topics is interesting, from indigenous health policies in the Philippines, thank you, Ryan, to OOP under health insurance in Africa, thank you, Abigail, to the first 1,000 days, an intersectoral action for health initiative in South Africa, thank you, Ida, to the capacity of the health system to influence and generate social values, thank you, Eleanor, and to the methodological paper addressing an approach to investigate actor dynamics and power dynamics. Thank you, Rakesh. Now, as a program, what we are doing is raising the profile of this very important field, and we are supporting the emergence of new LMIC scholars conducting this sort of work in their own settings, asking questions of relevance to those settings and drawing on resources within those settings. It is incredibly valuable to see these scholars emerge. Thank you, Zubin.
Thank you, Lucy, for that response. I'd like questions for Irene. So what do you see as the value of HPA work in LMICs in general, and why do you think it's important to strengthen HPA capacity in LMICs?
Okay, thank you, Zubin, and congratulations to Lucy and Maylene and the whole cohort for this excellent supplement. I will talk with my hat on as somebody who spent years and years in active policy and practice and has now retired from active policy and practice. And what I will say is the value of this work is that actually I see a lot of interest in evidence to policy and a lot of people wanting to see evidence inform policy. And I think the answers to how to influence policy lies in this body of work. Unfortunately, there's often a disconnect between the knowledge in academia and the people who are out there struggling with the issues in practice. And I think it's really great that the capacity is being built and strengthened within low and middle income countries for this kind of work. And even as I congratulate the group on this work, I encourage each of you to find ways of getting this information out there to the people who are day-to-day engaged in actual policy and practice, because there's a wealth of knowledge which could help them in their work. And it is a challenge because it's going to need the thinking as to how do you get this kind of information, which is so well packaged in this supplement, now to people who are very busy and may only read a quick paragraph in the newspaper, a quick brief or something. So once again, congratulations. And I really encourage you to add this to this wonderful work you've done. Thank you.
Thank you, Irene. So my next question is to Mulinga. So what do you think you're enjoying about and learning from the HPA Fellowship Program, particularly in the virtual format that it's been forced into on account of COVID-19?
Thank you, Zubin. For me, it's been quite amazing to see how the fellowship has pivoted to navigate the challenges posed by the COVID pandemic to offering this virtual platform, which comes with many advantages. And one thing I'm definitely enjoying is through the virtual programming is a sustained engagement, as well as the sense of community that comes with being part of this particular cohort and people of similar minds doing similar work. So the PhD journey can be a bit lonely and isolating, especially in these COVID times, but through the fellowship activities, I am constantly reminded that I'm not alone on this path. And the activities that we have, for instance, our monthly meeting, it kind of gives me a monthly dose of energy and inspiration to carry me forward. So on the aspect of learning, it has been very beneficial to me, the Health Policy Analysis Fellowship, and I'll try and highlight 2 or 3 things that have mainly stood out for me. So the first are the sessions on methodological approaches to conducting health policy work. I come from a natural science background, and the policy, the fellowship has been very instrumental and beneficial to improving my understanding on the theoretical underpinnings of health policy analysis, as well as the approaches that I can use to examine the different aspects of the policy process. For instance, we've heard today about my colleagues from cohort 1 who looked at issues of actor and power and influences of power on the policy process. So that has been greatly beneficial to me, as I am able to understand how and where and in what ways to analyze policy. Secondly, I'll speak about the mentorship classes and sessions that we have with leaders in the health policy analysis field, some of whom I'm privileged to be sharing this platform with. So this has been an opportunity for me to stand on the shoulders of giants, as they say, and the value of having their critical eye, their experience as they review my work has been valuable and immeasurable. And lastly, but by no means the least, it has been wonderful to be part of the peer learning processes that happen in each cohort. So through our cohort, we've been helping one another understand the problems that we are going through, helping each other conceptualize, find solutions to the problems that we have. And it has been helpful for me to see how my colleagues are applying the different methodological approaches to their work, to understanding diverse health challenges from their settings. So that has added value to my learning. And these 3 aspects that I've spoken about of the fellowship programming, they have greatly improved the quality of my PhD work, where I'm trying to understand how policies for healthy diets and healthy environments can be reformed in my country. And it has expanded my skills and capacity to conduct further work on new and old health system challenges that plague countries like my own, which is Zambia, and other LMICs. So I am greatly confident in my skills, and I appreciate the platform and all the learnings that are occurring. Thank you.
Thank you, Mulinga, for those insights. My next question is to Eleanor. So having been a cohort 1 fellow and now helping coordinate cohort 2, also having written a paper for this edition, what do you see as the value add of this program, and how do you think that you've been able to maintain them and they've been maintained between rounds 1 and rounds 2?
Thanks, Zubin, for the question. I think some of this has been said by Mulinga already, but I think For me, the value adds were in three parts. Firstly, in sort of confidence building, in feeling myself to be a part of a community of researchers, and kind of feeling like I kind of grew into myself as an analyst within that cohort, and that was incredible. And then just in terms of exposure to HPA ideas that went, started maybe with some of the kind of basics of health policy analysis, but really grew over the course of the fellowship. And I think the kind of length of the fellowship is one of its real assets, because over the course of the fellowship, we engaged with so many more like innovative and sort of creative ways of doing HPA, whether that was methods or frameworks or concepts, and indeed pulled from many of the kind of other disciplines that HPA draws from. And that happened kind of alongside our PhD progression. So as we were developing our own understanding of our phenomena of interest and of what it was that we were trying to explore, I really felt that the sort of exposure to new approaches to doing that exploration was incredibly helpful. And then just to have so many eyes, so many perspectives, the sort of wealth of between the mentors and the peers, the HPA fellows, the sort of wealth of input, of sharing of knowledge and ideas, kind of really helped me in terms of conceptualizing what I wanted my initial PhD outputs to be and what I wanted them to look like. And I honestly don't think that the paper that's in the special edition would have looked anything like what it looked like without that range of input. So that was really valuable. And then I think that kind of links to how we've tried to carry that forward, despite having to shift into an entirely online program. The program was always somewhat online because obviously everyone's in different countries. So we did come together in face-to-face workshops once a year, but between that we were engaging online. But we did consider it as a challenge because we were wary of losing the kind of interpersonal connection that I think is one of the most, we call it the cohort building part of the cohort, but it's very important because that's kind of where your confidence grows in, is your sense of community with your peers. So one of the things that we've tried to do is make sure that we have enough kind of social time in our online engagement so that people feel like the fellows feel like they are getting to know each other. This year specifically, we have slowed down a little bit, so given ourselves a little bit less to do in each of our online sessions, and that really allows people sort of time and space to think. The ability to say something, maybe it's not the most important input in terms of the content, in terms of the topic, but it is a sharing of something that you've been struggling with yourself or whatever the case may be that really adds to the cohort building. And then another way that we've tried to do that is through these, what we call these peer learning segments, where fellows are able to bring a challenge that they're struggling with and get input from their peers and from their mentors as well. Sorry. So I think that has been helpful for the fellows in terms of feeling like you are learning from each other. And so kind of finding a way to not just be throwing information at the fellows, but rather allow for learning from one another and also just getting to know each other, because it's quite personal to share whatever your challenge is at the moment. And it adds to that kind of cohort building, I think. I'll stop there.
Guys are on mute. Thank you, Eleanor. So just to all the participants, you have the opportunity of posing questions in the Q&A, and we encourage you to pose questions which you pose to either one of the panelists or more of the panelists. I'd like to now come on to the question to Shivakami. As someone outside the HPA field who has supervised 2 HPA fellows now, what do you think has been the value add of this program? And what do you think about the program that lets it add value to your work?
Thank you, Zubin. It's wonderful to be here and reflecting about this HPA fellowship, which we started a couple of years ago. I echo some of the points that have come in by the other panelists, Eleanor and Mulinga. So I'm going to give 4 points from my perspective. Firstly, the funding provided by the fellowship is generous enough to cover multiple publications in good international peer-reviewed public health journals. We all know equity in publication is a major challenge for most LMIC researchers, irrespective of whether you are an established researcher or a young researcher, because of the lack of funding overall for research, and in particular for the publication fees for research. So from that angle, this HPA fellowship allows the research scholars to aim high, from my perspective, without worrying about the publication fees, and focus on really a high impact, good quality paper to be published in a good journal, which I think is immensely helpful for their self-esteem and confidence in their work at an early stage in their career. Additionally, the international exposure they get through the conference like HSR, and getting an opportunity to share and discuss their work at a global level gives them a scope to take their work to the next level and build collaborations among the academicians globally. So that's, for me, stands out. And secondly, the mentoring provided through this fellowship is not a one-time thing. The continuous engagement with the HPA fellows and allowed us to shape the work over time and get multiple feedbacks into improving it. I want to point out specifically that the HPA mentors dedicated substantial amount of time at different stages of their research that helped with the final output, which one is very proud of, which you can see from the 7 publications and also the promising work that the second cohort is going to be producing. Moreover, the resources shared during the sessions not only focuses on the HPA component specifically, but also on the academic research skills in general, which are extremely useful to shape the PhD researchers. They do not just help the scholars within the HPA fellowship, but they have been useful even mentoring my other research scholars who are facing or who were facing similar challenges in their research. And in particular, we have been inspired by the fellowship format, more specifically the peer support learning, both Eleanor and Mulinga has pointed out. The peer support format, we have started with my scholars, our own PhD solidarity circle, where we have sessions, presentations such as small ideas, proposals, and potential papers, and some personal sessions too, where we discuss the personal as well as the professional challenges that we are encountering in our PhD journey. We found this has been immensely useful and extremely useful, especially in the current circumstances where we are all away from our campuses, our libraries, and our peers, more importantly. Thirdly, I deeply appreciate the conceptualization of fellowship that extends the support to the research supervisors as well, which is this is the first one-off thing I have come across. This allows us to engage with the materials, allows us, the supervisors, to allow us to engage with the materials. And in my case, this exposed me to a whole range, completely different field like HPA. This broadens my own scope of work. And also, engaging with the other mentors and their way of working allows me to observe, learn, shape to be a better mentor to my own scholars. I strongly believe that critical yet positive mentoring is not just good for the mental health of our own research scholars, but has an intergenerational effect. You be a good mentor, positive mentor, you produce a future positive mentor cohorts. Lastly, I'm the kind of person who's filled with joy and excitement to see my students flourish. And seeing my PhD scholar Sudha work getting the recognition it deserves, and all her hard work getting paid off, and recognizing the crucial role of the HPA Fellowship in that journey for her makes me really excited and grateful that she got this opportunity and we got this opportunity. And I cannot wait to see Saurav's work, my second scholar in the second cohort. Yes, I'm so lucky to have two scholars having been part of the HPA Fellowship. His work getting shaped and receiving the recognition that it would deserve. So I cannot wait for those days for the second edition of inaugurations like this. Thank you so much.
Thank you, Shivakami, for those thoughts and reflections, and particularly how this program is, as both the cohorts, it's been proven to be such have two LMIC-based young scholars, particularly around publication. And this is something which, of course, was one of the aims of the program, to spur this critical mass of HPA researchers based in LMICs, and also the innovation around involving the doctoral supervisors to ensure that the students are getting similar messaging and help to, again, build capacity within institutions within LMICs around HPA. Now it's open to the participants. If you have any questions, please post them in the chat box. I've seen a couple of questions more on logistics in terms of, is the HPA Fellowship still running? We have a current cohort which is running till the end of next year, where we haven't come to the decision whether we're going to have a third round of HPA Fellows. Given the responses, it would be a great thing to have a third round. I agree with that. But we currently don't have any applications open. So we have some questions around that. No, there's no potential scope for applications at this moment, but there may be well so in the future. Any other questions from participants?
2 minutes, Lucy.
Yeah, go ahead.
I wonder if I could ask Sudha in particular, and I'm picking up on Irene's initial point, how she feels her work is already being applied or could be applied to strengthen the health system in India. And I'm putting Sudha on the spot, so I forgive me, Sudha.
Thanks, Lucy. It's a tough question to answer. I think if we could strengthen India's health system so easily, we would have done it many years ago. But I think the HPA fellowships, the sort of theories, the methods, the ideas that it offered, it helped me look deeper into things that I was already looking at. So it just gives you a new lens to look at things that you already knew were happening in the field, and it also helps you understand some of them better. So which was something I couldn't have done without having that initial theoretical framing. And the fellowship offered me that to a large extent. So let's say something like this doctor's piece that I would have looked at in a pre-fellowship mode. For me, doctors were people in the front line. They were people who were implementing things. And when I thought of a policy maker, there is somebody who is sitting, say, in New Delhi, in the capital of India, and doing things. So I think that perception really changed for me. So for me now, even people, so the whole, the concept of the policy process is something that I understood during the course of a fellowship. So it's not something that, so when the people who are implementing it, the people who are doing it, everybody is a policy maker. So for the community, the person that he sees, the doctor, that person is also a policy maker. That person is the face of the policy, in fact, for the community. And this kind of understanding really helps my work today, to think of frontline as political actors and not just implementers. So yes, that's what I would say. Thank you so much.
Thank you, Sudha. So Moses, if you were to reflect on how your work has could influence policy in Uganda, what would you say about what would we need to do that?
Thank you very much, Zubin. I am already part of work that is going on in the country. to try and reflect on the current overlaps across policies within the health sector, to try and understand where are the opportunities to begin harmonizing and policies across programs, health programs in the sector. So I think for me that is a good starting point in the right direction. And then subsequently we'll be looking at also the policies themselves after understanding, are there areas of synergies, are there overlaps and duplications that we need to start teasing out within the policies, and then go ahead to begin analyzing now a deeper analysis of the policies to help guide both policy reforms and also reforming overall the health system in the country to improve efficiency and performance.
Thank you, Moses, for that. So Irene, you mentioned about the importance of getting this in formats ready for policymakers, how do you actually get to communicate this? But what are the kind of things you think need to happen within policy institutions and ministries to actually increase receptivity to this kind of work, other than just putting our work in formats which are easy for them to appreciate? What are the kind of strategies, approaches reflecting on your own work that you think would enable HPA to more directly inform policy and achieve what we just discussed with Suzanne?
Sorry, Zubin, is the question a general question or are you asking me?
I was posing it to you based on your experience
okay,
working
sorry.
in both the research side and the policy side of things.
Okay, my apologies. Initially, I thought you were throwing a general question to everybody here. I threw a question to challenge your panelists and you've thrown it back to me. I think basically what I was trying to do was to encourage these fellows. I really think you've done great work, very interesting work. And I think actually often people are thinking that evidence to policy has to do with things like, hard data from the global burden of disease or from a clinical trial of effectiveness. But my observation from working in the health sector is often, actually, there's a lot of that technical information out there. What really, if I can pick on something like, the work Sudha has just talked about, the work Jacob has talked about, you listen closely to them and you realize that actually what is making the difference in what gets done and what does not get done is not necessarily the hard evidence on what works and what does not work. It's that understanding of people and power and their interactions with the system. And I think sometimes finding a way to translate some of this knowledge to the people who are battling with health systems can better equip them to make a difference. So if I can be really practical and hands-on, for example, you will find that decision makers are at all levels, as Sudha's work has said. She brought out the fact that policies are decisions, decision makers are at the national level and they are at the front line. But do decision makers have access to the wealth of information that you all have from a theoretical academic perspective, which is helping you with your analysis, to be able to translate that to help them to deal with systems? I don't know if I'm obscuring the question or making it clearer. So for example, I would encourage you, not all this work could be presented in a blog, but I would encourage you, for example, if you know people, sometimes I find people in the Ministry of Health are reading their WhatsApp messages way more often than they are reading their email. If you work in a Ministry of Health like that, could you have a small blog that you WhatsApp to people in the Ministry of Health? If the people in your Ministry of Health are always reading the daily newspaper, and many of them do, because something policymakers do is they scan out there for this vague thing called public opinion. and they scan out there for it in the mass media. Is it possible for you to partner with somebody who does more journalistic writing, or do it yourself and do a small piece in your local newspaper about what you have found, and, you know, just present it to your local government level? That's the kind of thinking I'm kind of, because I think it's such great work. You know, for me, I'll read it because I love academics as well as loving policy and practice. Not everybody who's out there battling with things will read this journal, unfortunately, but they might read it if they see an interesting short piece on it in a newspaper, on a website, etc. So just a little nudge that go a bit further. You've done great work. Thank you.
Thank you, Irene, for those reflections. So we have a question from Pragati. So I'll address this to Lucy. So Pragati has posed a question: is there a community of practice or forum where individuals other than HPA fellows working in the area of policy and implementation in HPSR can interact?
Great question, and really pleased to hear of others wanting to get involved in this area. So my suggestion is that if you are a part of the SHAPES thematic working group of Health Systems Global, that thematic working group has a policy analysis cluster. And that might be a particular network that you could get involved with and support, but also learn from. That would be one place to go. There has also been linked to the Health Systems Research Symposia. There's now been 2 global policy symposia that have been run at roughly the same time. And there's another community of practice that I guess only comes together at the time of the symposia, but that also presents and discusses very interesting work. So join us. Thank you.
Thank you, Lucy. So another question, next question from Mary. And I'm going to address this question both to Sudha and to Moses. So Sudha first, you, then Moses. What have you learned through the HPA Fellowship of your experience to navigate the politics of your own health policy analysis, especially when you're dealing with more sensitive findings? And how do you navigate these politics and still be able to influence the health system? This is the kind of interaction you have to have with people within the health system, and yet be able to so study it, be critical about it, and yet contribute to policy.
So I think one of my first questions was, when I looked at these issues, that power is important. I understand that through the theory that power is important, the hierarchy is important, inequities exist, and we don't have the kind of leadership that we want. And a lot of things, what we call software in health systems, they're not really conducive to having good outcomes. So my next question was, if this is what it is, how do we do something about it? And I think what I've slowly understood, and I wouldn't say I'm there yet, but is that change, or these are things which the kind of health system that we have, these are age-old institutions. So the kind of issues that we are talking about, they have been established over time. So change is never easy for anyone. It's not easy for me or for others. So when we are putting people through that process of change, it is important not to be critical, but more empathetic with them about this process, and we have to give it time. So and understand that change is a slow process. It's going to take time and effort on our part. And I know co-producing and co-working with governments, with people, a lot of things which Irene was talking about, it's much more work, so it can slow things down a little more, but because you have to take people along with you, but these things cannot change when we try to impose it top down and say, okay, these corruption practices cannot exist, or we have to improve leadership. But those processes have to be built right from bottom up, where people are. At least that's what I think I have learned. Thank you.
Moses, the same question for you.
Quite a hard one, Zubin, but let me give it a try. So I think that for me, my work on understanding interests and power and how that drives policies in unexpected directions help us to appreciate the fact that first, that policies are not separate pieces of documents as we presume, which are innocent, that these are people's decisions, which decisions represent their interests. And so the policy process really is about trying to navigate and moving those interests towards, to a great extent, the public interest. And I must say that you cannot eliminate the personal interest completely from the policy process. And two, the other important thing I've learned is that we have, in our country, there's a lot of discussion, talk about, we have good policies, but they are not well implemented. I think this exposes the fact that what looks glittering on the surface is not necessarily good. And having the interventions that we know work does not necessarily mean, and having them in the document does not mean that it is necessarily a good document. But how these interventions are assembled and supported, and the underlying interests behind those documents that we see and apply would help us to think about whether the policy would work or not. And for me, in the policy process, therefore, it is important, as moving forward, to begin paying more attention to more than the surface of the interventions, but to the interests that underpin these interventions that we're beginning to forward and front in the policies.
Thank you, Moses, for those reflections. Mulinga, as someone who is in the second cohort, how do you hope to use your work to influence policy? I know it's a tough one and you still haven't developed your work fully, but it'd be good to get some ideas now.
Okay, thanks, Zubin. So there are a lot of ways in which the information that we are generating and the work that I'm doing and the data that I'll generate, there are a lot of ways in which it can improve the policy landscape and how things are done in my country. So one thing I am particularly interested in is kind of help to strengthen the structures or find ways in which to provide a platform, a stronger platform and an improved and a strengthened platform to anchor the downstream interventions that we have. So looking at issues of nutrition and healthy diets, eating healthy is not easy for many Zambians, and we have to kind of find out and look at ways in which we are going to make things easy for the average population out there. So one of the ways, and I will pick from what Irene has said, is to kind of break down the information that I will have into bite-sized bits and engage with policymakers and find ways to have these reforms which will help change the way things are. So the platforms for engagement are there. I'm looking forward to further engaging and using the platforms that are available to me to kind of build the structures that we need for interventions to be implemented.
Again. Thank you, Mulinga, for that. I had one question, Lucy. What do you think are the knowledge gaps that really remain to be addressed in HP and LMICs, particularly, I mean, the major areas I think there will still be much more work. As we all know, this program was designed to start addressing some of the gaps, and we've moved from just agenda setting work to also looking at more work on implementation and confronting power and politics more directly than we've done before. What do you think are the most important remaining gaps?
Thanks, Zubin. And that's a big question to end on. And in a way, part of the answer is it's not my question to answer. It is the question that colleagues in this fellowship program, colleagues based in their particular settings, it is they who need to identify the questions that are relevant to those settings. And I don't say that lightly, because I think that the relevance to setting is a really key issue, and it links to then how the knowledge is used to inform policy change more generally. but I would welcome more work myself that tracks policy change prospectively and therefore provides the opportunity for a loop back into supporting and enabling change over time. Zubin, if you'll allow me one more second in this slot, I would like to thank everybody within the fellowship program as we wrap up. That is both cohorts, some of whom you've met today, but not all of whom you've met today. I would like to thank also the supervisors and have been really pleased that Shivakami was able to be part of this panel, because supervisors are part of our team, and I really appreciated the way Shivakami herself is drawing on the work that we're doing in the program to spread it more widely. And I think that's one of the ways the program can have impact. And I also want to acknowledge Irene as a mentor in the first cohort, a supervisor herself, and clearly somebody whose shoulders we all stand on in the field of health policy analysis. And then finally, again, to thank my colleague, Melin Chung-King, who's not here today, who's been a part of the program, and also the Alliance for raising the profile of this area of work and supporting its development. Thank you so much.
Thank you, Lucy. And now we're almost out of time. Thank you to all the participants, all the presenters, panelists, and participants. And I think what this shows is the 120 people we have here shows that we've moved this field forward, that we have critical mass of people interested in this area, that we're progressing in this area. And I think that also reflects on the success of the work we've been doing in the health policy analysis mentorship program. And it's also, I would just refer you all to another piece of work that was produced as part of this capacity strengthening work in collaboration between the Alliance and UCP, which is the Health Policy Analysis Reader, which is available at the Alliance for Health Policy System Research website, and it's really downloadable. It brings together a wide range of resources, including commentaries plus papers that can help illustrate some of the major issues in health policy analysis. This was led by Lucy, of course, from UCT. And with that, I'd like to end this webinar and thank you once again for your participation and for your support and enthusiasm for this work. Thank you and good afternoon, good evening. Bye-bye.
Thank you.
All right, bye.
Thank you.
Bye.
It's wonderful to be here.
Bye-bye.